Hi, everyone. I'm Steve Freedland. I'm a urologist at Cedar-Sinai Medical Center, as well as the Durham VA Hospital in Durham, North Carolina. And I'm joined by my good friend and partner in crime there, Dr. Farnoosh Nik-Ahd. Do you want to introduce yourself?
Hi, everyone. Hi, Steve. Thanks so much for having me. My name's Farnoosh Nik-Ahd, and I'm one of the chief residents at UCSF in the Department of Urology. I work very closely with Steve on our work on transgender health outcomes, specifically in prostate cancer. So it's a pleasure to be here.
Yeah, no, it's great to be here for Transgender Awareness Week, and I mean, it's a growing segment of the population for sure, and there's a lot of health challenges that transgender people face, and our interest in that has really been in the prostate cancer side of things and helping transgender women specifically, people are assigned male at birth to know as they grow up and identify as women that they still have a prostate no matter what are done. So I know Farnoosh, you certainly led the charge on this. Been first author on a lot of groundbreaking research here. So give us some insights in that and then let's we can have a little bit of discussion about how to actually implement this in the real world.
Yeah, so really exciting work that we've done together. But really, it's exactly what you said, that transgender women retain their prostate whether or not they've undergone gender affirmation surgery, and so they remain at risk of prostate cancer. And they should still be considered for prostate cancer screening, which often is in the form of PSA screening. And what we've looked at in the past is looking at prostate cancer outcomes in transgender women when they're diagnosed with prostate cancer. And we actually had a few really interesting findings from that work. First, being that prostate cancer actually is not as rare as it was previously thought prior to our study. Second, we also found that for those who were actively on estrogen when they were diagnosed with prostate cancer, that they actually had more aggressive disease at diagnosis, suggesting that there are potential delays in diagnosis. Now, our numbers were small in that latter point, but we thought that those trends were really interesting. And we thought further about what the potential causes of that could be. And while it's likely multifactorial, there's multiple things contributing to that, such as different rates of PSA screening, or that, estrogen itself has either a protective or a suppressive effect in the development of prostate cancer. But what was really intriguing to us was the possibility that prostate cancer might be being missed in this population because the PSA values that we reference are not appropriate for use in transgender women who are on hormones. So next, we did a different study where we actually looked at PSA values in transgender women who didn't have prostate cancer, just to understand, what does a PSA value in someone who's on estrogen actually look like? And we found that the PSA values are quite low.
Yeah, so, I mean, when you say quite low, give us some numbers. I mean, and how does that compare to, cisgender men aren't on hormones?
Yeah, astonishingly low. Specifically, our median value for transgender women um, who were on estrogen for at least 6 months was 0.02. So,
Wow.
as a point of comparison, for an age-matched cisgender man, the median PSA is 1. So it's 50-fold lower.
Yeah. So, I mean, the challenge is, that we know that for transgender women who ultimately go on estrogen, the health benefits in terms of psychological, gender congruity are huge, right? The mental health benefits are huge. So, I mean, I don't think the answer, and you get some pundits out there, well, these people shouldn't be on estrogen, that it just shows estrogen's bad. That's not the answer, right? I mean, that's clearly not what we're saying. For transgender women, who choose to go on estrogen is clearly the right answer for the mental health and all the benefits. It's just we need to understand, like, what does it mean? Because you look at it, let's take cisgender people, for example, right? Where we're not giving testosterone, estrogen, but they naturally have estrogen and testosterone. They get different diseases. Actually, cisgender women live longer than cisgender men, right? So again, we're not saying good or bad, but it's we need to understand this. So what, you know, do we need to be telling our listeners, cisgender women in particular, who have prostates? What's the message that we need to? How do we convey that? I don't know what the right answer is. How do we get that message out in a supportive way, coming from an allyship that we want to be? We're obviously not transgender ourselves, so but we're trying to be supportive. How do we get that message out?
Yeah, it's a really important question. And, we're really at the beginning. I remember when we started this work, you and I were blown away that there was nothing on this topic, so we're really at the beginning of our understanding. And I think to all the listeners out there, the important takeaway message, it really just starts with raising awareness that transgender women, they're a growing segment of the population. They deserve just as much health care as anybody else, and that we just have to be aware of their unique healthcare needs. And part of that is routine screening for their organ-based cancers. So for transgender women, that includes prostate cancer because they still have a prostate. So we just have to be sensitive to that and be aware of that and make sure that both patients and the clinicians who are caring for them know that. So I think that's where we should start.
It's interesting. You say organ-based care, and I think it's an interesting concept that and you and I have discussed this, and something that we're trying to I don't want to say pioneer, but advocate here for at Cedar-Sinai is like an organ inventory. Because you're born with certain organs, and during the gender affirmation process, some of those organs may or may not be removed. And so understanding your own body, and here's the list of organs I have. I mean, there's certain organs that are gender neutral, colon cancer screening, for example. But when you get to, things involved in reproductive, uterine, ovarian cancer, we don't have good screening for ovarian cancer, but testicles, prostates, and things, it's understanding, that what you have in your body. It's not a male, female, whatever, man, woman. It's just, this is your body. These are the organs you were born with. You know. So again, I struggle with how to put this implementation in the real world. I mean, I think we're pretty good at doing our research and publishing our papers, and we had some very nice success there. But then, as you really try to implement in the real world, I don't know. That's just outside my area. I think you're more in tune with that.
Yeah, I mean it's not a easy topic for sure. But I think it, just starts with working within the community, making sure we're doing our part so that people are aware of this issue. And trying to move the needle on a cancer that's been so heavily gendered. So when people think of prostate cancer, they probably think of it as a male cancer, similar to when people think of breast cancer, they probably think of it as a woman's cancer. So trying to reframe how we think about those cancers, exactly what you're saying, things like an organ-based inventory where we just take gender out of it and we keep it very objective, very anatomical. Things like that, I think, are really important so that we can have those discussions with patients and we can streamline how we think about what care each person needs, regardless of what their gender identity might be. But it's a challenging topic, and hopefully we can also continue in not just from a research front, but involving patients in the discussion too, to see how they think that the screening should go and what they think the best approach would be, since they're the ones living it.
Yeah, no, it's a good point, and I think it's forming that allyship and working with the community. And so I know through other mechanisms, you and I have recently been able to sit on some focus groups of transgender women and hear their thoughts on prostate cancer screening and PSA testing and interactions with the healthcare system in general. For me, as again, someone who's not transgender, has had relatively limited interactions with that community, it was really eye-opening. I
Yeah.
don't know, what was your thoughts about those?
Same. It was very eye-opening, and just seeing how traumatic and how terrible prior healthcare interactions had been across the board for patients was honestly really disheartening. It's 2024, and to see that that's still people's experience it was very upsetting. So I hope that we can do better, and our research is a good start to trying to move the needle on that and to try to make things better for everybody. But we just have to continue working with the community, continue working within our healthcare systems so that that isn't the experience of transgender people, so that, they're not encountering all this trauma and stigma and marginalization every single time they need to go to the doctor, let alone even finding a doctor who may be willing to take care of them just because they're transgender.
Yeah, no, I agree. It was very disturbing to hear some of the stories that we heard. Um, but I know you started to think about this as well. Is what is best practice for putting on our MD hats? Because I mean that's our expertise. I mean we're physicians. We take care of patients. What would be for those in the medical profession who are listening? What advice can we give in terms of what is best practice for how to identify that someone's transgender, because they do have different health needs, right? I mean, they have different organs and different things that you need to be aware of as a physician, but ultimately you need to take care of the whole patient. So how do we do this better? I'm not sure there's a perfect way, but how do we do it better?
Yeah. Well, I think the challenge right now is that there isn't a streamlined, unified way across different medical records. So every medical record is a little bit different. Sometimes it can get lost in the medical record, and then you are at risk of accidentally misgendering someone. So I think trying to pay attention to preferred names, preferred pronouns to help cue you in that someone is transgender, trying to fill out the organ-based inventories for the health systems that exists. Um, and, just talking to the patient and just bringing it up, and letting them know that, the intention behind it is to make sure we're taking the best possible care of them and that we're addressing their healthcare needs and keeping it strictly focused on the anatomy, and also involving the patient. Are these terms okay with you? Is it okay if we talk about this? Making sure that they're included in that dialogue so that the conversation can also be tailored to what the patient is comfortable with, and what they are, what they're even aware of. In my granted limited experience, a lot of transgender women may not even know that they still have their prostate, and especially for people who underwent gender affirming surgeries years ago, they may actually be under the impression that their prostate was removed. So I think a lot of that discussion may even need to start with just gauging what that person's understanding of their anatomy is, and then taking it from there.
Yeah, no, it's a good point. And I think, you know, in a healthcare setting, as a physician, we're being pushed to see more and more patients every day. Things are busy, and invariably mistakes are going to happen, right? And so I think that's where, a trying to prevent the mistakes, and I have a couple thoughts on that. But B, if it does happen, apologize, you know, and, just be very sympathetic, and there's ways to apologize and there's ways not to apologize. I mean, I see this in my kids that they're mad and screaming and they'll say sorry, but they don't mean it. You could look, they're not sorry what they did, versus like really, oh, I'm sorry I did that. I told myself I was going to be super careful. I really apologize, and we can document in our notes. I mean, I try to write a little personal thing about patients in the note. And that way I look at it right before I walk in the room and kind of jogs my memory. And so I can walk into the room and I'm like, oh, last time we met, you were good to go see your family on a trip, to back east or whatever. We're in LA. How was the trip? And they're like, wow, amazing memory. I'm like, I have some clues, that can clue me in and help. So that I think you documenting some of that, making sure you're looking at the note before you walk in the room, and it may say one name, but as you say, looking at what is the preferred name, looking at the pronouns. And we usually start our notes, it's 66-year-old black male, putting in that transgender, that word in there, so we have that quick cue. You're seeing 20, 25, 30 or more patients in a day. You get 10 minutes per patient to get everything that's going on with them, but still in that 5 seconds you can just get a clue and go, okay, yeah, so it's a transgender woman, but they're going to have a prostate, because we know that's never removed despite whatever gender affirmation surgeries they undergo. So we can quickly orient ourselves.
Yeah.
I think using those little tricks for me
Yeah.
is helpful.
Yeah. And I think those little things, honestly, they go a long way. And I think they really go a long way in this patient population, because I think it's especially important. And I'm sure it would be much appreciated on the part of patients that were trying.
Correct. And I think that's the thing. I mean, what I heard from those focus groups is that it's not always done right, but when the healthcare provider really tried and cared, they were okay with mistakes. But
Yeah.
it's when someone's like, just, well, says you're a man, I don't care. That's what the note says. This is your name, and just like not getting it at all. That's when it seemed like the trauma was happening.
Yeah, absolutely.
Yeah. Um, well, any final thoughts? Where are we going with this field in terms of, prostate cancer, which is really kind of our area?
Yeah, I think that's what makes this work so exciting, that we're still really at the beginning, and there's so many directions that we can take this work. I think what we're most interested is in continuing down the PSA screening road and really trying to hammer out those details. How do we best screen this population? What should that screening look like? What PSA values should we be using as our reference ranges? Because clearly that upper limit of 4 that we use in cisgender men is really inappropriate for use in transgender women. And so just thinking through those topics and ultimately trying to get transgender women and their PSA screening represented in the guidelines, since so many of us use guidelines to help dictate the care that we provide. I think it's really important to make sure that those guidelines are inclusive and really represent all of the patients that we care for. So we're still charging away, and there's a lot of exciting things to come. And I really look forward to seeing where this work takes us, and hopefully we can really help our transgender patients and make things better for everyone that we're caring for.
Yeah, and I think that's the key I mean, it's fun to do research for the sake of research, ask intellectual questions, and it's, I feel like I'm a kid going to work every day. I feel like, you can just show up to work and ask why. It's that intellectual curiosity, and I see it in my little kids. They want to learn about the world, and we want to learn about the world as well, but it actually is hopefully making a difference. And
Yeah.
that's why it's so rewarding, at least for myself, and
Yeah.
I like similar. So, all right. No, it's been great talking to you, Farnoosh. Always a pleasure. And
Yes.
thanks to our listeners for, listening in for Transgender Awareness Week. Thanks.
Thank you for having me.